Hi everyone. Today we're exploring how pathogens affect the body from the outside in, starting with the skin and soft tissues, moving into muscle and bone, and finishing with the nervous system. These infections range from mild to life-threatening, so let's dive into how to identify, treat, and prevent them. We'll look at common culprits, from bacteria causing skin issues to viruses attacking our central nervous system, and even the mysterious prions. My aim today is to equip you with a solid foundation, helping you recognize the signs, understand the mechanisms, and appreciate the medical interventions that can make all the difference. Think of this as a guided tour through the battlegrounds within our own bodies. We'll see how our defenses work, how pathogens try to breach them, and what happens when they succeed. From the outermost layer of your skin to the delicate tissues of your brain, we'll cover a wide spectrum of infectious diseases. Let's begin. Our skin is the body's formidable first-line barrier, but when compromised by cuts, abrasions, or bites, it allows opportunistic microbes like bacteria and fungi to invade, causing troublesome infection. Bacteria like Staph aureus and Strep pyogenes cause various skin infections. Impetigo shows as crusty sores. Cellulitis presents red, swollen skin. Erysipelas has raised borders. Necrotizing fasciitis is a surgical emergency. Acne arises from clogged follicles and P. acnes overgrowth. Leprosy, from M. leprae, tragically damages nerves and skin, leading to disfigurement if not treated early and effectively. Osteomyelitis signifies infection spreading to the bone, often caused by Staph aureus. This serious condition can result from trauma or nearby soft tissue infections, requiring intensive treatment. Tinea infections or cutaneous mycoses target skin, hair, and nails. Examples include Tinea pedis, athlete's foot, Tinea cruris, jock itch, and Tinea corporis, ringworm. Candida albicans, a yeast, causes infections in warm, moist body areas like the mouth or groin. Immunosuppressed individuals or those on antibiotics are particularly vulnerable to these opportunistic infections. Subcutaneous mycoses occur when fungi enter via cuts, affecting deeper tissues. Sporotrichosis, the rose gardener's disease, often requires specific antifungal therapy for resolution. The central nervous system is protected by the blood-brain barrier and meninges. However, once pathogens breach these defenses, infections are challenging to treat, making early detection critical. Bacterial meningitis, caused by Neisseria meningitidis, strep pneumonia, or Haemophilus influenzae, presents with fever, headache, stiff neck, and light sensitivity. Immediate intravenous antibiotics are vitally important. Viral meningitis is typically less severe and self-limiting. Encephalitis, brain inflammation can be caused by herpes or arboviruses, possibly leading to confusion, seizures, or even coma. Prions cause rare, invariably fatal neurodegenerative brain diseases like Creutzfeldt-Jakob disease. These devastating conditions are currently untreatable. Prevention focuses on safe surgical and transplant practices to avoid transmission. Norovirus reigns as the #1 cause of gastroenteritis worldwide. Foodborne bacteria like Salmonella, E. coli, and Shigella frequently cause distressing diarrhea, abdominal cramps, and sometimes fever. Helicobacter pylori remarkably survives harsh stomach acid, often leading to peptic ulcers. Treatment involves a combination of specific antibiotics and acid-reducing medications to eradicate this persistent bacterium. As nurses, you are pivotal in early infection identification, implementing isolation precautions, administering treatment, and educating patients. Always advocate for hygiene, vaccination, and timely medical intervention. Thanks for tuning in. I know that was a lot of information to process. Please review your chapters and slides thoroughly, and bring any questions you have to class. Outro: stay curious, stay healthy. All right, everyone, that was a comprehensive journey through the world of pathogens, from those pesky skin invaders all the way to the serious threats to our nervous system. It's a massive amount of information, I get it, but Understanding these microscopic foes, how they operate, how our bodies fight back, and crucially, how we can prevent them from causing harm, is so incredibly important. Whether you're on the path to becoming a healthcare hero, or you're simply driven by a desire to understand your own health and the environment we live in, what you've learned today is foundational. Remember, medicine is a field that never stands still. It's always evolving, always presenting new challenges and new discoveries. So, my biggest piece of advice is to stay curious, keep asking those why questions, and never stop learning. Thanks for watching, and I'll see you in the next one.